Hey everyone, so I'm Eric, and I'm going to be talking about my senior year 2020 through 21 mentorships. So, first off, I started in medical orthopedics in September of 2020. This was like the heat of the pandemic. I was really lucky to have gotten in there at all. It was kind of a surprise for me and everyone that I managed to do it. But then I was unfortunately forced to leave after only 5 weeks as the cases surged again. I was with Dr. Patton, and he's a hand and elbow surgeon. And I was only able to follow him in the Winrock Clinic, which is the one that was closest to me. And I couldn't get into the surgery center because of COVID. And I was there for 7, 8 hours per week. So, what I would do in a normal day is I would come in and observe. We would probably see like 30 or so patients, which is like a lot for the amount of time I was there. It was really rapid fire. I would see him diagnose a lot of common problems such as basal joint arthritis, PIP, and DIP joints. Um, Mostly what people were seeing there for was hand and wrist arthritis. The treatments he would always recommend would either be arthroplasty, which is shown in this diagram here, which is complete orthopedic reconstruction using metal to replace the destroyed bone for bone on bone arthritis, or cortisone injections, where you put steroids into the inflamed area, which will reduce the pain for about 6 or so weeks. Or honestly, some people just, you get to tell them, like, this isn't that bad. Like, I know it hurts, but nothing I can do. So when I was there, I found it really interesting to see how important money is, especially in a large corporate office like Mexico Orthopedics. There's like 50 doctors on staff and like hundreds more of MAs and other staffers like helping support. So a lot of money was rolling through the clinic at all times. And that can be good because obviously, it'll attract talented people to become orthopedic surgeons. Then that competition will make them, in theory, give you better care if they want to make more money. And also, it'd be a really good career for me if I were wanted to be a surgeon because there's a lot of money in it. And it's also, though, a little bit bad as it leads to a little bit, not like cost cutting, but a little bit of price gouging. Some things are more expensive than they needed to be there. And when you're handling such a mass quantity of patients, it's not like the treatment's bad. It's just, it's different. And something I also learned there is sometimes it's better to just live with like certain types of pain there. Obviously I'm not experiencing arthritis, so I don't know. But I know for when I'm older that if I'm experiencing like small bits of pain, to just deal with it because it's going to be a lot less of a hassle than going into a orthopedic surgeon office and deal with it. It's interesting to the ethics of surgery. It's difficult, obviously, to validate it as it's a highly invasive procedure. It's going to majorly impact the quality of life, either one way or the other, for people, especially if any of the risks like infection, like someone's life. They could lose a hand if surgery was somehow done wrong. So after that, I was not really having a mentorship for about 2 months. But then I was able to get into pediatric associates in January 2021. And as of today, April 12th, I'm still going and will be going till April 30th. And I was with Dr. McNamara. I was going in for 4 to 7 hours per week, and she was a pediatrician. So luckily, because I'm still here, I actually have some photos of what I was going on here. So we have here a picture of the a normal exam room and a little bit of the things in it, including there's the eye charts, there's the bed, and then we can see the so here we can see the otoscope, that you would use for ear and eye examinations that I got to see being used all the time. The infant scale, the cotton alcohol swabs that are used to sanitize everything that touches a patient, the tongue depressors. Obviously, there's a sink in there. There's the eye exam area, and then here's some of like the files that you would give for paperwork. Because obviously, one thing that's definitely true in medicine, there's a lot of paperwork. So then in here, we actually have a picture of Dr. McNamara there. And this is her office that you can see there's a lot of samples there. Everyone likes to drop off samples at doctors' offices to try and get them to sell them to their patients. And then next in her room, you can't see this in the main picture, but there's a supply cabinet with lots of disposable medical supplies. And then also some of the tests. Like we would run strep throat tests based off of simple culture and urine analysis tests. And then here was Dr. McNamara's personal kind of, I guess you would say, someone of a library that I would always tend to look at when there was a